to begin with your assessment this evening, and I'm going to start by doing an overall visual assessment of your hair and your scalp as well as your back. Now, several things that I'm looking for specifically, and I really want to ensure that we relieve some tension today, so I think I should go ahead and begin by just kind of getting a feel for what exactly could be causing your symptoms. So let me just have a look for a second and see if there's anything I notice that's particularly concerning. So just looking at a couple different areas. So I do see some distension here at the thoracic spine. It appears as if there's just a little bit of swelling at the tail of the scapula, so that's something that I will assess. So just getting a feel for the overall energy, and it does appear as if there's a little bit of stress being held here. Have a look with my light and see if there's anything I could be missing. Visual inspection so far. So again, noting a couple areas of excess tension specifically here. Holes that we can assess as well. Okay. So, top of the scalp, gonna feel around for any abnormal textures or lumps. Okay, so I'm going to start by introducing physical examination here, and I'm going to go ahead and just begin by applying a gentle pressure with my fingers, mainly feeling around at the different areas of your cranium. Looking for areas of tension, specifically at the nape of the neck, where I tend to see an excess. So also just feeling the skin. I do notice some slight temperature variations here as well. Alright, so have a little bit of a further look at your scalp. There are a couple areas assess specifically. So I'm just going to begin by having a look here. So immediately, scalp color appears slightly pale. I am noticing maybe just a little bit of loss of the saturation of pigment there. So it could just mean that you are not getting quite as much circulation as I would like to see. And sometimes that can lead to tension headaches. So if you have a buildup of tension, a buildup of blood flow in certain areas in comparison to others, it can here for sure. Definitely just a little bit of a cause for concern. Okay, so we'll also just have a look here. A small area of concern here. So I do notice just a little bit of excess dryness in this one area particularly, which again leads me to believe that there is a lack of oxygenation circulating through the scalp. I see a little bit of dandruff here. So that's something that we will have to further assess as we continue with the examination. So let me just have a look. Let's see if there are any other areas that are equally as concerning. Okay. Again, a slight distinction of the color of your skin versus the color of your scalp. I'm definitely seeing further loss of pigmentation, and it seems to be concentrated towards the nape of the neck. So as suspected, there's definitely an issue with tension happening here. Okay. Slight buildup of fluid here at the thoracic spine. medial here to the nape of the neck, which is what I suspected. So I definitely see a need for some tension relief. So what I'm going to do, just to start, is bring your hair towards me. So just moving forward here. So just checking for bilateral tension, which I do see, but it appears as if the bulk of it is here. Medial, so I'm just going to check that. Yeah. Okay. Definitely seeing a big jump here. Put a pair of gloves on just to give me a little bit more traction. Okay, so definitely noting issue. Begin by attempting to differentiate between tension of the scalp versus tension of the spine. I want to see if these issues are connected. So I'm going to hold taut on the nape here and just assess. For symmetry, I'm looking to see if there's any wasting as pressure is applied, if there's any difference in the muscle tone, which would indicate a weakening of the muscles of your neck. So I'm just going to use this tool. Just assessing different zones of pressure. So we typically hold excess tension here. Just getting a feel for how much is being held here. I'm going to do the same at the top of the neck here, so just stretching the skin in a manner that allows me to assess for fluid retention, which I am noting. So some definite edema secondary to tension buildup is present. anticipate as I move outwards, it's not quite as prevalent. I am noting the majority of it here. Fluid buildup is malleable, so that is a good sign. Just gonna comb this area. Looking for any abnormality in the skin itself. So the skin at the very base of the hairline here, I am seeing some slight discoloration. Very light pinkish color there. Just ensuring that this is not simply an external issue, but it is in fact internal as well. The ears, and again I see some abnormal texture here. Apply some pressure here. Okay. I'm going to move on to assessing the neck and back, and just really getting a feel for all areas here. Just pinching slightly. Encouraging blood flow to the surface of the skin as I continue to assess for any areas of concern. I do feel one small nodule here. I'm going to do just a little bit of light therapy in this area specifically. So you're going to feel a little bit of pressure. Just working out this area that I definitely feel is slightly impacted with tension. There's a small nodule here that I feel can be assessed gradually. Good, so we've already seen movement there. I'm going to just work my way down the spine and feel for anything else along the vertebrae that I think is contributing. So very gently working directly along the spine. A small area of tension. Just want to see if what I'm feeling is above or below the surface of the skin. To further assessing. I'm feeling just a little bit here as well. Out there. I can actually just track that. Okay, so tension appears to be which leads me to believe that this could be a postural issue, so possibly there's an alignment issue happening where you're either not engaging your core and therefore not supporting yourself adequately, or there's a misalignment of the actual skeletal system. So that is something that would have to be assessed further, but I just want to see if there's anything there's definitely a difference of about a half an inch here, so there appears to be a slight shift, whereas your right side is slightly misaligned, so 9 inches there. Okay, so that matches. So it's really just that top portion that's not quite. Okay, so we have 7.5 here, about 7.25. Starting to see what the problem is here. So I am going to begin with a couple therapies here, and I'm going to start just introducing some mild bone conduction therapy in these areas. So we're going to go with a little more force and see how that does in comparison. So still getting movement consecutively here. Definitely better there. Good. Still a little jumpy. We're getting Alright, so just gonna do some migrating therapy here. So essentially going to connect these points. And encourage downward and outward movement. See what response we got on this side. Very good. So this was your highest point of tension. Let's just encourage movement here. You're releasing pressure, pushing the tension downward and outward. move diagonally. Encourage deep breathing, so I want you to focus on your respiratory system. Allow that tension to release. Go in and ensure that all of that tension has been dispersed. Feeling a lot better. Just for any areas that still feel tinnitus, but I believe that helped. So I'm going to go back in and retest here. Definitely don't see as much tension as was here before. Slightly less rigid. Seeing more movement consecutively with the neck and thoracic spine. Going to do some very gentle needling, just further encouraging encouraging a release of that tension in these areas. Follow that up once down the spine and across. Just sweeping. Sweeping of any last tension. does feel quite a bit better. I definitely see a reduction here. It's not quite as edematous or protrude as it was previously. So closing out your session, just sending calming energy to you, allowing you to rest. Tension is gone.